Okay, so before I invite Dr. Ida on stage, so allow me to just introduce Dr. Ida. So Dr. Ida actually graduated from Glasgow University in 1997, and she obtained her specialist qualification in 2010. She had 14 years of experience working in the obstetrics and gynecology in the United Kingdom and had come over to NUH Gynecological Oncology team as the lead in gynecological cancer screening and prevention, okay? So apart from being a specialist in obstetrics and gynecology, she's also a United Kingdom accredited colposcopist working within the NHS cervical screening program. Her interests are pre-invasive disease, human papilloma virus, cancer screening and prevention, including multidisciplinary approach to care for women with pre-invasive disease. She's actively involved in our Women's Gynecological Cancer Committee. So I'll invite Dr. Ida up on stage to give the talk on HPV vaccination and cervical cancer.
Good afternoon, everybody. Sorry. Thank you so much for coming on a Saturday. Can you hear me? Yeah? Okay. So today we're going to talk about HPV and cervical cancer. I'm not going to talk just about vaccine because that's half of the battle. Okay? I'm going to talk about everything. I'm going to talk about how we all going to prevent cervical cancer. As Grace said, that I work in NUH. My job actually is to make sure you do not see the cancer specialist, especially the women. Okay? So there are some cancers that we can screen, and there are some cancers that we can't. So what we're going to talk today, now for you to understand cervical cancer and what actually it involves to prevent it, you need to understand the disease itself. You don't understand the disease, then you won't be able to appreciate the importance of screening and vaccine. You have to understand the implication to you as an individual and to your family, and that's what we're going to talk about. Know how you can prevent the disease for you and your family, and then also, as Grace has already showed you, where to get the support that you need to do this. Okay? Now, first of all, just want to show you this picture. This is the picture that I show your children when I go on a talk in the school for the HPV vaccination program. This is a flu virus. Who's here has not had flu? You must be Superman or Superwoman. Who's here has had flu? Lots of us has flu. Why? Because flu is very, very common, okay? It's a very, very common virus. There's a lot of types of flu. You can have flu A, flu B, whatever type of flu, and all of them can infect you, okay? So, the thing is, about 9 out of 10 of us in this room or in Singapore will have a flu virus in us or on us, especially in our nose, without us knowing it because it's not causing any symptoms. It just sits there, it doesn't do anything. About 1 of us probably will have a little bit of flu, okay? A little bit of symptoms. So in our kids, in ourselves as well, sometimes it's just a bit of sniffles, we can still go to work, but sometimes it's just really, really bad, we just need to stay at home and we can't really work because what happens when we go to work when we have flu? We'll spread it to everybody else, okay? So, but then the great thing about any kind of viral infection is that our body has already been engineered since we were born, before we were born, to fight any viral infection, okay? The healthier you are, the better your immune system, and therefore you can just most people will get rid of flu very, very easily, okay? Can take 1 week, can take 1 day, can take 2 weeks, but you will get better. Okay, so the other thing about flu is that even though majority of flu viruses are not dangerous, who remembers the H1N1 scare? Okay, very, very, very rare that somebody will get H1N1 and then they're gonna, be very ill or they're going to die from it. Okay, and what do we do if we want to prevent getting flu in future? Remember, everybody, our bosses, my boss keep on kind of like nagging me to get the flu vaccine all the time because he doesn't want me to take MC from work, okay? So everybody needs to get their flu vaccine, but flu vaccines you have to take every year because there's so many types of flu, okay? So basically, if we want to prevent flu, what do? We want to make sure our immune system is actually strong, Okay? So strong, that means you need to eat healthy, and all the health promotion board kind of promotion and things that you have to eat healthy. Nowadays, I think in the MRT, they have shown all this Spartan person and all this, the more team and the less team and all that. That's actually is important because you need to eat healthy, you need to be active, and the other thing that you need to have your flu shots because your immune system is actually important. Even though you don't know, it's actually always fighting viruses that's coming to you. So this is the flu virus. I'm going to show you this. This is its distant cousin, the HPV virus, or human papilloma virus, okay? It's similar, but it's not the same because this causes flu, this causes cervical cancer, okay? It is still very, very common. It's as common as the flu virus. Like the flu as well, not all of them are dangerous, okay? And the good thing about this virus, now, so if you Google causes of cancer, okay, and I Googled this kind of like this morning, you know when somebody don't really know the answer if you ask them a question and they beat around the bush, right? They don't really straight tell you this is the answer. They go, maybe it's this, 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 this. So if you Google what causes breast cancer, certain risk factors, blah, 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 blah. What causes bowel cancer? Certain risk factors, blah, 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 blah. What causes liver cancer? Certain risk factors, blah, 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 blah. What causes womb cancer? It's the same. What causes ovarian cancer? It's all the same. But if you Google what causes cervical cancer, one answer, human papilloma virus. There is no doubt that actually HPV does cause cancer. And this is the only cancer at the moment that we know the cause. And the good thing about knowing the cause is that then now we know how to treat it and how to prevent it, okay? And it's not just Google that's saying this. We have known this for a wee while. This is one of the very famous papers that was published a wee while ago. And this basically, this gentleman here actually took tissue from a lot of cancer women and he did HPV test on it, and 99.7% of all the cervical cancer tissue has HPV infection. Okay, so it is no doubt that HPV is actually the necessary cause for cervical cancer. Still not 100% because we still have cervical cancer that's not caused by HPV, but 99.7% of cervical cancer is caused by this virus. As I said before, most flu viruses are most HPV are not dangerous. About 8 out of 10 of us will have this virus on us at some point in time, okay? The virus itself is not dangerous, okay, just like flu, because our immune system is always trying to get rid of this virus. It usually doesn't cause anything. And any good thing that sometimes you have this small group of viruses from this very large number of HPV that is actually the culprit for cervical cancer. There's about 150 types of HPV that we know at the moment. There are only 14 types that we know is related to cancer. So the HPV infection itself, if you have HPV infection, the infection is not dangerous. Basically, what will be dangerous is that if there's persistent infection, and we talk about that a little bit later. And of all the 14 HPV cancer-related viruses, number 16 and number 18 are the most common. And this makes 70% of all cervical cancer. And this is just another illustration of that. This is a big family of HPV. There are some HPV that cause genital warts, okay? Number 6 and number 11. HPV that cause genital warts do not cause cancer. You can have genital warts as much as you want, if you want it, okay? But it's not going to cause cancer. But it can be prevented as well, and we'll talk about that later as well. 14 types that we know causes cancer, and from that, 16 and 18 are the worst culprit, 70% of it, and not just in Singapore, 70% worldwide. So if you have any woman, we take any woman with cervical cancer, whether it's in Singapore, in Australia, in the USA, in Cambodia, in Malaysia, anywhere in the world, if you do HPV tests on them, I can bet you that 70% of the time, it's because of 16 and 18. It is what we call an equal opportunity virus, okay? It doesn't care who you are, it will infect you, okay? And it will cause cancer. Doesn't care how much you earn, it doesn't care whether you are a boy or a girl, it doesn't care whether you live in a very nice house or live in a very, very tiny urban, rural area somewhere. If you have HPV, then you will get infected. Now, we're going to talk about cervical cancer. That's the cervix. Does anybody here not know what a cervix is? I'm just assuming everybody does, okay? Very important organ, the neck of the womb, okay? It's situated basically at the bottom of the womb, just between the vagina and the womb itself. Extremely important organ because it holds the pregnancy in, okay? And also for women as well, it's actually a very small organ, but it is a very important organ. This is cervical cancer. Cancer, we can see, okay? You missed the boat already if you've got cancer, because there's a lot of things that we can do to prevent it. How do we get cervical cancer? And basically what happens is that when we get exposed to the HPV, the virus. Now, HPV virus is a skin-to-skin contact, including sexual contact, not just by sex. You can get HPV infection by oral sex, anal sex, okay, any heavy petting, you can get it from sex toys, and that's why if you are in a same-sex relationship and you're using sex toys, you still have to go for your screening, okay? Right. The good thing about HPV infection is that, like the flu virus, even though all of us will be exposed to the virus at some point in our life, 95% of the virus, our body will sort it out themselves. It will get rid of the infection within 2 years. If the body gets rid of the infection, it doesn't increase your risk of cervical cancer. And that's why from infection to cancer, it actually takes up to 30 years. So if you know somebody here that has cervical cancer now in her 50s or the 60s, I can bet you that virus has been there for at least 20, 30 years. Okay, and that's why screening works, because of the long history of developing cervical cancer from the infection. That's why if you go for your regular screening, chances of us picking it up before it becomes cancer is very high. And I mean regular. We'll talk about that in a few minutes. There are, in some women, majority obviously will regress. There are some women, and we don't know why, but we know that those who are immunosuppressed, those who with HIV, those with solid organ transplant, or those who are on multiple medication which suppress their immunity, those are slightly higher increased risk of cervical cancer. But majority of us, even though our risk is high, most of us will get rid of the infection without us knowing it. It's just a small group of us that will keep that have persistent infection, and that slowly will change the cells on the cervix to become cancer if we do not actually screen. The other thing that I would like for you guys to understand as well is that HPV, especially HPV 16, even though we keep on saying that HPV causes cervical cancer, it actually does cause other cancers, okay? In men and women, remember, it's an equal opportunity virus. So basically, it can cause cervical cancer because it's the highest burden of all, okay? And we have a great screening tool for detecting cervical cancer, okay? It can cause vulvar cancer, it can cause vaginal cancer, it can cause anal cancer in both men and women, it can cause penile cancer. It can cause oropharyngeal cancer. Remember Michael Douglas, okay? He had throat cancer. That was HPV, HPV 16, okay? So, but the burden of the other cancers are actually very, very low, okay? So that's why in a lot of countries, including Singapore, we actually are concentrating on cervical cancer prevention when we're talking about the vaccine, but we know that the vaccine can also prevent from all these other cancers as well, especially anal cancer. Okay? How bad is cervical cancer? We are lucky in Singapore, actually, because we have a national cervical cancer screening program and we have vaccines. Everywhere else around the world, I've been talking here for about a few minutes. Every 2 minutes, a woman dies of cervical cancer. And this is a preventable cancer. This is the only preventable cancer. Other cancers, yes, we can screen, but when we screen other cancers, it's to downgrade the stage, okay? Basically means that they have to change to cancer first, and then we will try and screen to make sure we get it at stage 1 rather than at stage 3, okay? That's what happens with breast cancer, colorectal cancer, okay? But it's still very important to screen, because if you're at stage 1, much easier to treat, and survival rate is much, 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 much better. Cervical cancer is the only cancer that we can actually screen and prevent the infection before it actually becomes cancer. It's stage 0, and the treatment is actually very effective for pre-cancer, okay? How bad is cervical cancer in Singapore? Well, for a developed country with a national cervical cancer screening program and HPV vaccine available, it's still actually in the top 10, unfortunately. There are a lot of reasons for this, but it shouldn't be here. Other countries, such as the UK and the Europe, where there is also national screening, these are all rich countries. We are a very rich country, okay? We have access to everything. Other countries is not even in the top 10 at all, even not in the top 50, because it's very rare. But here, we still see cervical cancer. And it has gone down since the introduction of National Cervical Cancer Screening Program in 2004, but it hasn't gone down anymore, okay? And what we know from the last review of the statistics on women getting cervical cancer, there is a worrying trend. We find that in the last, since 2011 to 2015, the women that get cervical cancer around that time, there is an increase in the trend. A lot more women getting cervical cancer is preventable. A lot more women have been told, you got cervical cancer. And the more worrying thing as well is that the number of women 30 years and above getting cervical cancer is increasing. We're not screening our women, okay? The most highest risk are the Malay community, okay? And the other thing that is worrying as well is that it doesn't matter if you have cervical cancer in 2003 or even in 2015, the mortality rate is still the same. Once it becomes cancer, then you know the mortality rate has not changed since probably about more than 10 years ago, okay? And that's why preventing it is very, very important. Just to say as well that in the world, this is a US, the US data, the incidence of anal cancer is increasing as well. The incidence of genital warts in Singapore is also increasing. Genital warts very common, easily treated, okay? But very, very easily prevented, okay, as well. And this is one of the reasons why countries like Australia and the United Kingdom, they have actually practiced gender-neutral HPV vaccination, which means that they vaccinate their boys and girls, not just the girls, okay? Okay, when we talk about screening and prevention, they have to work together, okay? Because the vaccine protects future infection. Just like if you do not want flu, what do? You go get a flu jab. So if you encounter these viruses in future, you're already protected, okay? Screening is for current infection. For us that has already been exposed to the virus, okay, we want to make sure the virus has not caused changes to the cervix that has the potential to become cancer. You go for screening. You do not have to check your HPV status before you actually get the vaccine. And we talk about this a little bit later as well. So we're going to talk about current infection first. You need to understand when we talk about screening, it is not about any other diseases. Like when you go see your doctor because you have tummy pain, you go see doctor give medicine, oh, cure, yay, okay? It's nothing to do with that. Screening are done in healthy women. There is nothing wrong with any of you. Okay, healthy women. What we are trying to do is to make sure in 10, 20 years' time, you are still a healthy woman. And we do not have to sit down with you in our clinic and tell you, I'm sorry, madam, you have cervical cancer. And that's what we're trying to secure with screening and prevention. Screening does protect your future from cervical cancer. What we're actually checking with screening is that we are not actually screening for cancer. Cancer we can see. Your doctor can see cancer. Your cervix will not look right if it's cancer. What we are trying to screen is that we're trying to screen pre-cancer, okay? Pre-cancers are cells that is not cancer yet, but has the potential to become cancer. And some of the doctors that we work with, what I call as superpower, okay? My superpower is that I can actually see pre-cancer. Normal doctors cannot, okay? But we have to, but you need to go for screening before I can actually help you to prevent cancer. It is very effective, but you have to go regularly. Now, the women that get cervical cancer, actually there are two big groups, and this is the same everywhere worldwide. First one, never been for a pap smear. Either they don't know or they're too busy, okay? Never been. If you ask, there's a lot of times I ask, Madam, have you been for your pap smear? When's your last pap smear? Never done before, okay? And that's why, and the other group of women that we see a lot having cervical cancer are those that actually do not go for regular screening, which means that you ask them, Madam, did you go for your pap smear? You say, yeah, of course I did when my pap smear. When? 20 years ago. That doesn't work. One pap smear is not going to prevent you from cervical cancer. You need to do your pap smear regularly. Okay? So this is just to say, this is a cervix. This is a normal cervix, very nice looking, healthy cervix. Pre-cancer do not bleed. That's why you have to go for screening. HPV infection do not cause any symptoms. The only symptoms HPV infection causes an abnormal pap smear or abnormal screening result. This is pre-cancer, and I can see this if you are referred to me because these are all easily treated, office-based treatment, okay, for majority of them. Too late already, cervical cancer. And the problem with cervical cancer is that once you are waiting for the symptom, it's actually too late. Most symptoms present at stage 3 and stage 4 when they've already spread. Okay? So, regular screening is very, very important. So, if you haven't actually realized, the government actually, knowing about the importance of screening, has actually updated the cervical cancer screening starting May 2019 to a better screening tool, okay, for women, much older women. Now, for 25 to 29 years old, so our screening starts from 25, only if you've ever had sex, either previously or currently, okay? So basically, if you've never had sex before ever, you don't have to go for screening. Your risk of cervical cancer is very low because your exposure to the virus that causes cervical cancer is actually extremely low, that the screening is not going to help you, okay? However, if you've had sexual activity before, if you've been sexual active before, even though it's that one time somewhere you can't remember, and after that you've never had sex ever in your life, you still have to go for your pap smear. Okay? Even if you've only had one partner and your partner has one partner and it's you, you still have to go for your pap smear. Okay? The risk of you getting cervical cancer is probably lower than somebody that has multiple partners, but it's not zero. Okay? Because your chances are you've been exposed. So if you are 30 to 69 years old, currently the national screening program says that you can have a HPV test every 5 years. For 25 to 29 years old, you get a pap smear every 3 years. Okay? If you have a low immune system, and this is actually determined by your doctor, okay, then the screening is actually slightly different. Okay, but your doctor will actually inform you, or the pap smear nurse will inform you which one. But majority of us falls into this category. Screening starts from 25. It doesn't start from 24, 20, 21. Doesn't matter if you're sexually active at 20, you still start screening at 25. It doesn't matter if you start having sex at 19 or 24. You start screening at 25 years old, because the risk of you getting cervical cancer when you are much younger is very, very low. There's no point screening you then. But the chances of any doctors act on an abnormal screening result and cause more damage in future and risk in future is much higher if you screen you too young. So that's why we start from 25. Where can I get the cervical cancer screening? So how do we do? Everybody here knows how to do we do a pap smear, right? Yeah, okay, all the women here, I'm hoping that everybody has gone for their pap smear. Nobody likes doing it, but it's something that you just have to go and do. Anybody here knows how we do a HPV test? Exactly the same way, okay? At the moment, exactly the same way. What we are trying to do in NUH is trying to see whether we can actually do self-sampling. You take your own HPV test. It's been done in outside, worldwide, but it's not done in Singapore. So hopefully, watch this space. Maybe by next year, you don't even have to see a doctor to do your own cervical cancer screening. Okay? You can get it in polyclinic and GP under Cervical Screen Singapore. You can ask your own doctor, or you can go to the hospital. Okay? My advice is go into 2 places. Please go polyclinic. Okay? Under the Cervical Screening Singapore, because the same test is done in all these places. The same test is done in all these places, but a HPV test in polyclinic, you will only pay $22.50. If you do it in the hospital, you will pay at least $100. It's the same test. Okay? So, the other place, but if you don't want to pay anything, okay, just come to Singapore Cancer Society. They give it to you free. Okay? This is the only society that actually is giving this free. But you do have to go to their Bishan clinic to get it done. But hey, it's free, okay? It's the same test, okay? The HPV test is the same test anywhere you go in Singapore, anywhere you go in the world. Just that the price is different. Now, what does my result mean, okay? Why do we actually offer the pap smear to 25 and 29 years old? Because when you are in your 20s, the chances of you having a positive HPV test because of transient infection, because you're more exposed to HPV rather than when we are older, is much higher. So if we do a HPV test on you, 90% of the time it's going to be positive. You're going to get stressed out, but actually you're probably going to get rid of that infection in 6 months or a year. But with a positive HPV test, then you are actually at risk of having unnecessary investigation and unnecessary treatment with unnecessary stress. And that's what we don't want, because screening is not just about preventing disease. Screening is also about safety. Safety for our women. So we do not want our women to be over-treated. We do not want our women to be over-screened. We don't want you to waste your money. Okay? If you have a negative or a normal pap smear, it means that your cervix at the time, there is no abnormal cell that can change to cancer that actually we have picked up. Come back every 3 years. Every 3 years is more than enough. Okay? As long as you come regularly, we will pick up pre-cancer if it's there. If it's positive, it does not mean that you have cancer, because if you have cancer, the doctor that did the pap smear will already tell you, because we can see cancer. Chances are your cervix is normal, but the pap smear say maybe there is some pre-cancer there, we don't know. So you get referred to a colposcopist or a assessment center, which is the 3 hospitals in Singapore, having a closer look at your cervix to make sure that actually your risk is still very low. Okay? If you are 30 to 69 and you did a HPV test, if it's negative, it means that your test, there is no high-risk cancer-related HPV infection at the time. You may have a HPV infection, but it may most likely the low risk, because we don't check low-risk HPV, because low-risk HPV don't cause cancer. We don't want to stress you for no apparent reason, and there's no medical benefit for it. We only want to see the 14 that can cause cancer. So if it's negative, you come back in 5 years, because why? Because we know that your risk of getting cervical cancer in the next 5 years is actually 0.3%. Less than 1%. There is no point of doing a HPV test every year. Okay? Doing a HPV test every 5 years is equivalent to doing a pap smear every year for 5 years. Okay? So there's no point in doing 2 tests either, because 1 is expensive and 2 is not beneficial. You either do, if you're 30 to 69, you're better off doing HPV test. If you are younger, you're better off doing a pap smear. Okay? So if you have a positive test, it does not mean you have cancer. It just means that you have the virus that causes cervical cancer. Whether you have pre-cancer, or if there's any changes to your cervix, we don't know. That's why you just need to come to the hospital to get reassessed. And then the doctor will confirm to make sure that everything's okay. So That's screening, okay? We just take a breather, and then you can ask me any question later. So we're going to talk about future infection, okay? That one was current infection, okay, for all of us, okay? We have all these 3 vaccines in Singapore. Does anybody not know about the vaccine? Everybody knows about them. Oh, one of them. Excellent, okay? So I'm going to start from the very beginning. Remember this slide? This is one of the slides I show your kids, okay? So HPV, smiley, smiley, because most of them don't cause anything. 14 types causes cervical cancer. These are the ones that we are trying to prevent. HPV 16 and 18 are the main culprit. There are 3 types of vaccine, okay? Cervix, Gardasil, Gardasil 9, okay? All of them will cover you or protect you equally effectively from HPV 16 and 18. All of them. It doesn't matter which vaccine you take. They all will protect you from 16 and 18 more than 90% of the time, okay? The only difference between the vaccine are the other covers that they do, okay? Cervix only covers 16 and 18. Remember, there's 14 cancer viruses. 2 out of 14 is covered by Cervix. Gardasil also covers HPV 16, 2 out of the 14 cancer viruses, but it also covers you from genital warts. And the protection from genital warts is more than 99%, okay? Gardasil covers you the most. 16, 18, genital warts, just like Gardasil, Gardasil 9, but it covers you an extra 5 cancer-related vaccine, cancer-related virus, okay? That means that it covers you 7 out of the 14 cancer-related virus, making protection from 70% only up to 90% of all cervical cancer in the world. Now remember, there is no vaccine at the moment that covers 100% of HPV. There's none. If somebody is trying to sell you a vaccine that covers 100% of cervical cancer, you're being conned. There's none in the world. In the world, these are all the 3 vaccines that you have. You will not get anything else. The name are also the same. They don't change. Okay, so that's why it's great for young women as well, because if they get their first dose here and they go to America or something, they just go, oh, just tell them that you had this, and then you can just finish your dose there. Or if you come to Singapore, you have your 3rd dose, and then, you know, somewhere else in the world, you go Malaysia, you go Australia, they're all the same. Okay, they're same vaccine. Because it doesn't cover 100%, every woman, regardless, even if you've been vaccinated, you must still go for your pap smear when you are eligible. And that will cover you, protect you from the 30% or the 10% of the cancer virus that the vaccine do not cover. And if you do this, or your kids do this when they grow up, chances of getting cervical cancer is near 0. 1 less cancer for you guys to worry about. Okay? So that's basically the beauty of cervical cancer and HPV. So, this is screening. Screening means that we are already infected. What we're doing is that we're damage control. We make sure that it doesn't progress to cancer. And that's why you have to go for your regular screening. Very important. Doesn't matter if you're busy, go to your doctor and get screening. Okay? It's only every 3 years or only every 5 years. You have time, it's 5 years, every 5 years. Okay? Prevention is basically preventing the infection from getting to you in the first place. And that's what the vaccine does, okay? So these two, as I said, has to work together. Facts about the vaccine. This is the boring slide. Basically, I have to tell you this, basically, okay? There is no virus in the vaccine, any of the vaccine. It's what we call a viral-like particle. It's an empty protein coat. It tricks the body to think that it's exposed to the virus, and it makes the body makes antibodies or immunity to the virus in future much higher compared to if your body makes it itself if you're naturally exposed, okay? And that's why when you do the vaccine, it's only 2 or 3 injection lifetime, okay? Cover. So it's a prophylactic vaccine. There are 3 types, as you know. Very high safety profile, and the thing is, it's because there is no virus in it. It is actually licensed in boys and girls from 9 to 26 in Singapore. the best time to give the vaccine is before any of us are sexually active. Okay? Because once you're sexually active, we actually can take the vaccine, but the protection will be slightly limited because chances are we've already may have been exposed to the virus before. For girls, it's licensed to protect cervical cancer, pre-cancer, genital warts, vulvar cancer, and vagina cancer, pre-cancer. For boys, actually in Singapore, it is licensed to be given to boys to protect against anal cancer, pre-cancer, genital warts, but only for Gardasil and Gardasil 9. Okay? So who will benefit from the vaccine? Okay, Singapore, as I said, 9 to 26-year-old, for girls only. In Singapore, you can pay by Medisave cover if you're 9 to 26-year-old, up to 400 a year for one person. But now, we also have a school HPV vaccination program that's been introduced to secondary 1 girls recently in May. And now they're also introducing a catch-up vaccine for the Sec 4. Okay? In October 2018, what they have found is that since they introduced the HPV vaccine about 12 years ago, there are now a lot of evidence to say that if you give the HPV vaccine to other groups of women, okay, either the ones that are sexually active, the ones that are much older than 27, the one who has previous abnormal pap smear, who had treatment for cervical cancer, and even in men, okay, there is still benefit protecting them from cancer in future. The protection is less. Studies have said maybe around between 20 to 80%, but we don't know where. But it depends on how exposed you are. But it is approved to be given to both men and women up to 45 years old. But you will need to go and ask your doctor about this. Actually, come to think of it, a lot of doctors don't really know about this. Just come to NUH and I'll talk to you about it. Okay. That's a little bit of advertisement for my hospital. How good is the HPV vaccine protection? If you want numbers, this is the first study on one of the vaccine, Gardasil, basically. When they give the vaccine to girls at that time that has never been sexually active, and then they follow them up, in terms of preventing from cervical, CIN2 and 3, which are pre-cancers, there is a 98% reduction from getting this, and also vaginal and vulvar cancer, there's a 100% reduction, and for genital warts, there's a protection up to about 99%. Very, very effective. There is no other vaccine, cancer vaccine, that can do this. You don't have vaccine for breast, you don't have to have vaccine for womb or ovarian cancer. You only have vaccine for this. And how long does the vaccine last? At the moment, we experts think it's lifetime. Okay, but we have actually now data up to about 12 years, and all those girls that has been vaccinated 12 years ago until now has no disease breakthrough, mainly which means that they've not had any HPV infection from HPV 16 and HPV 18. Okay, so when you do the vaccine, you complete the regime, and that's you for life. No more have to do a booster every year or anything. You don't need to do that. Okay. Okay. This is real world data, because basically we are very keen on real world data because it can look good in the lab, but sometimes in real world it doesn't work. Okay, so this is Australia. Australia actually was very visionary in that they introduced the HPV vaccine to their girls initially in 2007. Okay. School HPV vaccination program in 2007, and what they found is that now 2007, 2019, that's what, 12 years? Okay. HPV rate among women 18 to 24 have dropped from 22 to 1.1% between 2005 to 2015. Now it is known that most likely Australia is going to be the first country in the world to eradicate cervical cancer, because now not only do they have HPV school vaccination for girls, they've already introduced it to boys, and also they have HPV test as well. Okay. How safe it is, as I remember when I say that the vaccine does not have any viruses in it, The vaccine is, HPV vaccine is one of the vaccine that is monitored very, very, very closely by WHO, by CDC, by every vaccine monitoring organization that you can think of in the world. And thanks to the, basically to the scare by the MMR before, that was actually not true, because the doctor actually falsify the data. And that's why now all the vaccines, before they're being introduced to anybody, is being heavily monitored. And also WHO has actually made a statement to say that it is actually really extremely safe, with about just under 300 million doses were given by WHO in 2006. The most common adverse effect from the HPV vaccine is pain at the injection site. A little bit of red, a little bit of swelling. The fainting episodes that sometimes people report is not because of the vaccine, but because of the fact that when you say to a teenage girl that they are going to be injected, there's a lot of kind of like anxiety as well. Okay, so that's what they are. They've said that. You can get this in the internet if you want. And because of the effectiveness of HPV vaccine and the safety of it, and also that's why this is the Dr. Tedros, who is the Director General of WHO, World Health Organization. He actually made a statement in May 2018 for global elimination of cervical cancer. We can actually eliminate cervical cancer by vaccination, helped by screening, okay, if everybody does the same. Just like smallpox. Nobody gets smallpox now. Why? Because we don't get it anymore, because we get vaccinated as well, right? This is my son. This is my friend's daughter. So how do you give the vaccine? 9 to 14 years old, you only get 2 doses. You can give 3 doses if you want, but the protection is still the same. So give 2 doses. The recommendation for most is actually 0 months and 6 months. Okay? If you're above 15, this is him again. This is this year. 15 years and above for both girls and boys. 3 doses at 0 months, at 1 or 2 months, and then 6 months. Once they finish their regime, in 6 months' time, they can forget about it. There's no more booster that needs to be done. That's it. They are sorted. All they need to do for the girls is that later on, they just need to think about going for their pap smear. Okay, but their risk of getting an abnormal pap smear compared to myself or for some of us here is extremely much lower compared to them. And now in countries like Australia and Sweden, who has been practicing school HPV vaccination program for a wee while, they are actually thinking that maybe vaccinated girls shouldn't be coming for their screening as often as we do. Okay, so maybe they just need to come every 10 years. Okay, so that's the progress of the vaccine at the moment. No booster required for any of them. Okay. Where do you get the vaccine? Singapore Cancer Society, as Grace is saying, you can get the vaccine here if you have a CHARS card, Grace. Yeah, if you have a CHARS card, you can ask Grace some more regarding that. Okay. And then you can get it in polyclinics and GP practice. I can tell you now, if you go polyclinic, you only get Cervix. Polyclinic do not have Gardasil and Gardasil 9. The one thing as well, if you do want the vaccine, please ask your doctor which vaccine they are going to give you. Because a lot of doctors don't, and a lot of patients think there's only one vaccine. There's none. Different vaccines give you different cover. Make sure you know which cover you're getting. Okay? And you can come to hospital. We have a dedicated HPV vaccine clinic, but if you want Gardasil, Gardasil 9, then you just get your polyclinic doctor to refer to us for the, and then we can just give it to you, subsidized clinic. Even we have it in Teng Fong also have. Okay? Josephine here is my nurse, and she gives HPV vaccine to everybody, basically, that walks in. Okay? If you want any kind of like information regarding HPV vaccine, you can just come to any of the hospital. But I can tell you actually in terms of HPV primary screening and HPV vaccine, we actually introduced HPV primary in our hospital in 2014. We've been practicing it before the country has practiced it. Okay? Right. This is just, this is the information that we gave every woman that's asking about HPV vaccine or HPV test. Okay? Cervix, Gardasil, Gardasil 9. This is a summary or a short. If you are going for the school HPV vaccination program, your daughter's going to get Cervix. Okay? It's an opt-out if you do not want Cervix. No, it's an opt-out, yeah, okay? So all the daughters going to get Cervix. It's great. 70% cover is still great than zero cover. But if you do want other cover, and it's free, okay? But if you do want the other covers, like genital warts and other HPV viruses, then you can actually come to the hospital or you can come to SCS. Again, HPV, vaccine and screening has to work together, okay? Because vaccine gives you protect you from future infection, which is our future generation, okay? Your screening protects you from current infection, which is our current generation. So they have to work together, okay? Thank you very much.
Do you all have any questions? You can raise your hand. Yeah, over there.
Hello, thanks for the talking. So I have a question. There's a saying that the HPV vaccination could affect the woman's fertility. Do you have the data to compare the girls who already had the vaccination and the control group who didn't have? Do you have any data to show about that?
Well, the data actually, yeah. The thing is that when you talk about, when you Google about the risk of HPV in terms of other like death and then neurological problems and also fertility, there's not really good substantiated data. There's only one study, but the study says that in about 30,000 or 40,000 causes that. So it's actually very rare for that to happen. So you have to be careful when you read the blogs about it. You need to read actually the actual paper, because anti-vaxxers are very clever. Because anti-vaxxers are against every vaccine. It's not just the HPV vaccine, okay? And they can actually manipulate the data in a way that makes it quite scary. As I said as well, there's not really any direct association with fertility, and it's actually the occurrence is very rare, okay? And also there's no direct association between any other things like, some of the papers were saying their association with Guillain-Barré neurological orders and stuff like that. But if you read the actual paper, when they say that 50% of the women who got the vaccine had other symptoms, very dangerous symptoms, like I can't remember what it is. However, if you read the paper, it also actually says that 50% of the other group of women that got just water also shows the same kind of symptoms, okay? So that means that it occurs by chance. It's not because of the vaccine. And that's why the WHO and actually the World Organization would like everybody to know that it is actually a very safe vaccine. And we are still monitoring it very closely since its introduction 12 years ago. There's not really any cases come back with directly involving adverse effect, directly involving the vaccine. Yeah. As I said, there's about 300 million now has been given worldwide, and there's not really any reported cases yet.
Hi, morning, doctor. I have 4 girls in my family. I'm very grateful that there's such talk that for parents like us that to find out more. Okay, my number 3, who's in Sec 1, already had the first Cervix 2 months ago. But what if after knowing the vaccines, actually midway can I switch to Gardasil 9? I mean, is there any conflict? And what about how do I approach? And then what about the coverage? And then why if I switch, I mean, what is the coverage like? Yeah.
Okay. Very, very common question with a lot of parents. Unfortunately, at the moment, I do agree with you. There's not a lot of information for the parents about the vaccine before the school HPV vaccination program was launched, okay? And I do urge you to write to MOH regarding that, because it's not just you, but a lot of schools as well are actually getting frustrated or stressed about this. However, if you're already getting the first dose of Cervix, I would suggest you continue on, okay? Because it is a very good vaccine. It will protect her from 16 and 18, okay? There is no data, and we do not recommend you mixing the vaccine because we don't know what the protection is going to be. However, if you do want your doctor to get Gardasil 9, for example, okay? If you do get Gardasil or Gardasil 9, please remember, if your daughter already has Cervix, then the protection from 16 and 18 is not going to double up. That protection already sorted, okay? If your daughter wants to have Gardasil 9, the only protection that she will get is from the extra 5 viruses that can cause cancer plus genital warts. And you can actually, at the moment, we say that just wait a year before you give it. Actually, 6 months also can, but the current study has done it for after about a year. Okay, so she will get protected from the extra 5 and the genital wart virus. Okay, if you want Gardasil, then 16, 18 not protected more. It's protected already. You're gonna get protection only from genital warts, and the protection, if she's still not sexually active, and she's still young, then the protection will be great. More than 90% cover from all these viruses. Okay, so yeah, if you guys, that your daughter has already done Cervix, please continue with it, because it is a very good vaccine. It covers 70% of all cervical cancer. Okay, after that, if you decide to go, because I have to tell you, Gardasil 9, the price is double. If you go anywhere, it's obviously more cover, more money. Okay, at the moment. And the one Cervix is actually free in school. Yeah, okay.
Actually, my question is similar. Just wanted to check, like, for parents, how do we decide between the 3 vaccines then? Other than cost, the extra 5 other virus that's actually been covered.
Okay. How you decide how much protection do you want your kids to have, and that's what you that's how you decide.
So it's like a
It's
kiasu
entirely up to you.
mentality.
How much protection do you want your kids to have?
Okay.
Okay. So then you decide basically what you want. And you're right. The other thing as well is that no, I mean, you know, if I could actually give Gardasil 9 to every boys and girls in Singapore, I would. But it is a very expensive vaccine. It's double the price of the Gardasil and Cervix, and not everybody has the privilege to have that. Unfortunately, it is not the one that we are using in the school, but the government has said that chances are it will be in future, but we don't know when. Don't hold your breath, okay? But for individually, I mean, you know, if for your children, then basically, you know, I basically, you decide at the which one do you want your children to cover. If you're happy with 70% cover, that's great. It's still a good cover. If you're happy with 17% cover and genital warts, that's great as well. But if you really want the as much cover as possible, then that's okay as well. Because I support all 3 vaccines basically. The main thing is just get them vaccinated.
Will you be able to share the cost with us?
Cost in SES is free.
No, for the Gardasil 9.
Cost will be different from depending on where you go. Okay, for if you go to polyclinic and you get Cervix, obviously it's less than 400. You can go MediSafe. I can tell you what NUH cost. Okay, for NUH for 3 injection, either it's Cervix or Gardasil, is 385 for 3 injection. Okay, so about 128 plus, like somewhere there for 1 injection. For Gardasil 9, it's 674. So about 210, 215 per injection. Okay, so basically if you give them young, you only give 2 injections lah, so it's less. Okay, so so that's in NUH, and that's what. But if you go other hospital, they may have different prices.
So I have a couple of questions. The first one is, with respect to what else is, sorry.
Sorry.
No worries. in addition to the non-live vaccine, as you mentioned, what else is in the vaccine? That's number one.
There is, yep, okay.
And the second part is every vaccine carries a risk. Every single vaccine manufacturer will tell you there's a risk. So how in Singapore is that monitored and for how long? And if you think your child has had some vaccine damage from one of these, who tracks it? Where do you report it? How does it get reported?
Okay, so basically the other part of the vaccine is the adjuvant. Basically the adjuvant in the vaccine, if you actually get Gardasil 9, the adjuvant is about 500 micrograms, and for Gardasil, it's about 250. But these adjuvants are similar to the ones that you give for, like the vaccine for hepatitis vaccine, okay? So basically the adjuvant itself is similar to the ones with hepatitis vaccine that
But
you give.
what's actually in it?
I
What's
have
in
no
the
idea.
adjuvant?
Well, you need to kind of like, you have to ask the company, basically, okay? But one thing is for the Gardasil is that it is made from yeast extract. So one thing that we always ask the girls or the boys whenever you want to give the vaccine, the only thing that I ask is that, are you allergic to yeast? Because they do extract the vaccine. You have to put it in a to grow the vaccine as a yeast. So if you're allergic to yeast, then usually we'll not give it to you. For Cervix, I think they will ask if you're allergic to eggs because it's cultured in like an egg medium. Okay? In Singapore, the medical health ministry obviously monitor it, and then I believe that they monitor it alongside their infectious disease or their own CDC.
So is there an actual system for monitoring it? So if I have a child and I think my child has had damage, who do I go to? Where's the system that I can log in? So in the US they have VAERS,
Yeah.
but here what is the system?
So basically here, we don't have VAERS, okay? What we have is actually, usually what happens is that when the doctor recognizes or is reported that there is actually an allergic reaction, then the doctor is actually asked to report it to MOH straight away, okay? So I have to say that I've not encountered any of that at the moment in Singapore, so I'm not really much aware about who else that we need to report to. But I know that you basically just report it straight to MOH. You just call them or write the letter, and then they take it from there. The other person that actually is actually looking after the vaccine is obviously the Health Promotion Board, which is the vaccine team. Okay, but these are all in the Health Promotion Board and MOH website, so you can find from there. But I have to say, I do agree with you that in terms of introducing the vaccine in Singapore, it's not as big rife as it is in the US or Australia, basically.
Okay, because I'm really happy about that. And the reason I'm really happy about that is I do a lot of research. I spend all my time doing research. And the reason is that VAERS has got more reported adverse reactions for this than any other vaccine that's ever been introduced. And so that for me is a concern. And there are countries now that are withdrawing support. So India, Japan, Colombia, Denmark. And so for me, I think it's really important. I love the fact that you covered the importance of screening, because I think screening has to be the first line of defense. You have to get screened. But I also really hope that MOH continues to look and say, rather than just following what the FDA has done, what are we going to do here to monitor really closely and understand what's in the vaccine, how it might affect different kids differently? That's what I hope.
Yeah, so okay, so basically yes, but I do agree as well that, you know, it's difficult, isn't it, when you talk about side effects. I mean, certainly when you work if you work in VAERS, then you see a lot of side effects. But what is it in the context of the whole nation and the whole world? And I think it's the benefit and the risk of that as well. I mean, certainly at the moment, and in terms of Singapore, I believe that, and for myself as well personally, I still think that vaccine is really, really something that is very important if we want to protect the next generation from cervical cancer. However, I agree with you, it still needs to continue to be monitored. And HPV vaccine is the one that is most monitored now in terms of, with regards to all the other, I think with all the incidents that's happened before. At the moment, I mean, WHO as well, I mean, we always look at WHO as well for our reassurance as well. And then maybe in the next few years, maybe in 10 years, 20 years, there will be a statement. But at the moment, I do believe that vaccine is one of the most important things that you need to think about for your younger generation. Okay.
Okay, sorry, because in view of time, we probably can only take another 2 more questions. Is that okay? Yep, we'll just take another 2 more questions.
Sorry, I'm a latecomer here, so
okay.
I need to seek some clarification regarding the school's opt-in program. First question I have is, because we want the best for our daughters,
Yes.
so I'm checking with you, does the vaccination offers the Cardiac 9 that you mentioned just now?
It offers Cervix only.
So if that being the case, right, we shouldn't opt in into the program.
So basically, the reason why it's opt-in is because if you read the consent notes, the consent form of the school HPV vaccination program that your daughter will give to you, it does say that there are other types of vaccine, Gardasil and Gardasil 9. But for the school HPV vaccination program, that's why it's opt-in. Because if you're okay with it, you sign and say, yes, my daughter will take it. But if you don't want your daughter to have Cervix, you want your daughter actually to have Gardasil 9, then basically then you opt out and then you go to your doctor or SCS or somewhere else for the vaccine of your choice. Okay. However, certainly if you opt out, then you have to pay for the vaccine. It's not free. It's
okay.
only free and it's in school and it's Cervix.
Oh, okay. Thanks for your clarification. I know what to do then. Yeah, thank you.
Hi, I just want to clarify because I been to a few clinics and they offer different charges and some even quote me consultation charges for getting the vaccination and also with GST. Is this correct or we just need to pay for the vaccination cost?
Okay, so basically if you go see a doctor, if it's the first time, obviously you have to pay consultation charges anywhere you go in Singapore, okay? The reason is that it's not just taking the vaccine. Before we actually do give the daughter or whoever the vaccine, you obviously have to see the doctor first to be assessed whether 1, you are eligible for the vaccine or not. 2, is there anything that actually tells us that you cannot get the vaccine or shouldn't get the vaccine? And 3, all the counseling that you need to know about what you're getting. It's not just, I want the vaccine, boom, that's it, okay? So those are the ones, those are why you're paying for the consultation fee, okay? Once the doctor actually, it's not just about signing the form to get the vaccine. We actually do assess you to make sure that you are suitable for the vaccine. And I can say that 99% of the time, I mean, it's fine, but that's just part of the safety bit of it, okay? Then for all I can say is that for NUH, the first visit, for the first dose, yes, you have to pay consultation, whether it's a subsidized clinic or a private clinic. But the second and the third dose is usually just a technical visit because you've already been assessed by the doctor. So you just come in and get the vaccine done. The nurse at the treatment room will actually then check, make sure that you're still well. If she's not happy, then she'll tell the doctor, blah, blah, blah. But most of the time, I mean, the second and the third dose, you don't have to see a doctor anymore. Well, that's what happens in NUH. I don't really know about other places.
So will there be any difference if, let's say, I walk into NUH directly, or if I go through the polyclinic route, would there be any difference in cost if, let's say, I go for Gardasil 9?
So if you walk into G Clinic, I think the main problem with that is you're going to wait a very, 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 very long time, okay? Because you don't have an appointment, and the thing is that if you walk in, you don't have an appointment, they have to find a doctor to see you, or they have to make sure all the patients that has made appointment be seen first. And you may end up waiting 3 hours, 4 hours, okay, for that. But if you make an appointment from the polyclinic, then basically that polyclinic letter will allow you to go to the subsidized clinic in the hospital, and you have to pay the first consultation fee, and that would be a subsidized rate, okay? But if you go to a private doctor, and different doctor will have different consultation fees.
Thank you.
Okay, sorry, really last two questions. I know there's one in front and one here, then we won't be able to take any more questions, all right?
Now, thank you very much, first of all, for your time and explaining everything to us. I think it's been very, very helpful. But my main question is, during your talk, you did say that in 30 years, the number of cervical cancer we have expected haven't gone down as much as we expected. To able to help with that, why don't we lower the age of screening or provide free screening? For example, breast cancer free screening starts from 50. Same for cervical. Why can't that be lowered to 30?
Okay. What do you mean screening for cancer to lower it down to where?
Yeah, basically, if we monitor the screening from early age, so we can avoid the stage 3 and 4 diagnosis.
Okay. The reason why we are still in the top 10 is nothing to do with the age of the screening. It's because we are an opportunistic screening nation, okay? Compared to the UK, compared to a lot of European countries which have an organized cervical cancer screening, okay? Yeah. The difference between this is that when you have opportunistic screening, it is up to you and up to the doctor to remind you to go for your pap smear. That's why in actually our country, the uptake of screening is actually only 50%. A lot of women either do not know they need to go screening or they just they don't find time or anything like that. In an organized cervical cancer screening that in the United Kingdom, it means that the responsibility of that screening does not really fall to the doctor or to you, because a letter will automatically be generated to remind you, you need to go for screening, you need to go for screening, and you just have to go for screening to make sure that letter do not come. Every 3 years, every 5 years you get that. So it's basically, that's one of the reasons. The other reason why we do not want to screen women in much younger is, remember, screening is actually on healthy women. Okay? We always, when it comes to screening, we are always actually trying to balance between benefits and risks. Okay? Yeah. If the benefit is going to be lower than the risk, we won't do it. And we know that in terms of younger women, as I said to you before, chances of having an abnormal low-grade pap smear that does not go to cancer, or if you do a HPV test, chances of them getting HPV positive, which they will get rid of without increasing their risk of cancer, is much higher. So we are not really screening infection. We are trying to screen for disease. Okay? The incidence of cervical cancer increases when you're older. So that's why when you're screening on older generation, if you have a positive pap smear or a positive HPV test, it does mean something important, that your risk is high. But if you do it when you're 20 or when you're 24, if you do the screening to them, I can bet you that they will either have a positive HPV test or they have a positive low-grade pap smear. Then they will have to go to see their doctor, and that means and then there is a risk that they will be over-treated. Because a lot of doctors in Singapore, because it's opportunistic, we do not monitor the doctors in terms of, like the UK, every doctor that does screening is getting monitored. Not in the UK, okay? Not in Singapore. And that's the other thing when we are doing the guideline, that is what we take into context. The fact that we do not really have a registry yet that monitor all treatment. And this is the safest thing that we can do in Singapore to make sure young women do not get over-treatment. The problem with over-treatment is that if you get treatment for HPV infection rather than HPV-related disease when you're young, part of the treatment is actually to cut a small part of your cervix, which is called a lip or a cone biopsy, which is done a lot in either in a hospital or in the private sector, okay? The problem with doing that is that there's a risk of cervical incompetence in future. That means that if we do that when you're young, for no reason, if you don't understand the screening, the woman is at increased risk of having preterm labor or even premature delivery or miscarriages in future. Whatever we do to women, that it can actually affect their future fertility and their future pregnancy. So that's why we don't screen, because women in their 20s, the risk of cervical cancer is extremely low.
So what about 30s? I mean, we know breast cancer, cervical cancer, it's just affecting more younger and younger women. So, so don't do in 20s, but about 30s.
What do you mean?
That when women are in their 30s, why can't we start screening from
But we are screening the women from 30 years old.
So
the only problem is not all 30-year-olds in Singapore come for screening. That's the problem. And that's what we are trying to find out now. There's a lot of studies have actually looked at women across the ages, why you don't come for screening. And there's a lot of various reasons, but we know that in the younger women, some of the studies does say that, you know, they just can't get to the screening because they're too busy, or they don't understand the significance of screening, or, you know, if they're embarrassed about doing a pap smear, they fear the results. There's a lot of studies doing that. But in Singapore, there's not really, that's all in the Western world that has done all the studies. We don't really have those studies in Singapore yet, but watch this space.
Okay, thank you very much. Thank you for your time.
Hi, okay, my question is more for boys. Why are we doing it only for the girls and not the boys, if it's effective for boys as well? And are there boys who have gone for this in Singapore, especially Gardasil 9? And last question is, why can't the school's system allow us to pay the difference and get Gardasil 9?
Okay, very good question. Last question, I can't answer that. You have to actually go and talk to your Ministry of Health and their policy makers, okay? And yes, you can get, the boys can be vaccinated, okay? Why the school HPV vaccination program not introduced to boys? I also have no idea. You have to actually ask the Ministry of Health why they choose that. But basically, I think I'm assuming that because they want to fight against cervical cancer, okay? But, okay, no idea. If you do want, yes, boys can be vaccinated. I can tell you that, you know, there is not a lot of information regarding vaccination in boys out there, but we in NUH have been practicing gender-neutral vaccination since 2014. So basically, the boys that come, but unfortunately in NUH as well, because changes can be quite slow sometimes, okay, in Singapore or anywhere in the world. So my clinic, myself, okay, we do have a dedicated HPV vaccine clinic. We counsel them, and then as for both boys and girls, and those are actually a private clinic on a Saturday morning. But if you actually, some GPs do it as well, okay, and then for subsidized, actually, usually in NUH, we are starting to do that, but it is kind of a slow process as well, because it involves a lot of steps in a way. But at the moment, if you do want to vaccinate your boys, then what I can say to you is that we do have the vaccination clinic in NUH for that, but it is actually a private clinic. First consultation, you'll have to pay lah. Yeah. My boy got his HPV vaccine for his birthday, for his 12th birthday. He was not happy for that, but you know, so there are a lot of boys that do come, but I can say at the moment, because the education or the knowledge is not there, a lot of the ones that come to my clinic are medical people or who. Yeah, so UK will be introducing gender neutral in October. So that means that in school they are going to be vaccinating their girls and boys. And Australia has been introducing it, I think, since last year, I can't remember, but they've been practicing gender neutral for a while now. Should we watch the space? Don't hold your breath.
Because my girl is in JC1 now. And I don't think she's qualified for school related.
Yeah, so if you are not in the school program, which is Sec 1 initially, and catch-up is in Sec 4 and Sec 5, then you will have to go either polyclinic or to your own doctor, to any of the hospitals for the HPV vaccine. But they still are eligible for Medisafe if they are up to 26 years old. It's just that they are, but you have, it's not free lah, basically. It's just under Medisafe cover.
Okay, so thank you everyone, and let's give Dr. Ida a round of applause for delivering the talk.